As we continue to see cases of the COVID-19 Delta variant in our community and our schools, I would like to take this opportunity to clarify information regarding quarantines, COVID-19 testing, vaccines, and masks. We have received good questions from our parents, and I appreciate you being engaged in the well-being of our students and schools. I want to clear up some of the confusion around when a student should quarantine. Many parents have shared that they are not certain of the quarantine protocols. Your first call should be to your campus nurse or the district's health services team. Our registered nurses are resources to answer questions about the process and discuss your child's circumstances of exposure. Let's talk first about if your child is showing symptoms. You should keep your children home if they are having any symptoms in a way that is new or unusual, even if symptoms are mild. Please monitor symptoms and keep your child home even if there is not a fever. Most children who have COVID-19 don't have a fever right away. If students stay home with COVID-19 symptoms, there are 4 possible scenarios for the quarantine period to end. 1. Remain at home for 10 days after the onset of symptoms. 2. Return with a note from the doctor clearing them to be at school. The note must state an alternate diagnosis that explains the reason they're having the symptoms. 3. Return with a negative result PCR test. 4. Return with a negative rapid test collected on day 5 or later after symptoms. This is because the rapid test is more accurate after symptoms have been experienced for a little while. Now let's talk about a student who has been in close contact with someone who has COVID-19. Students and staff should quarantine if they have been in close contact with someone who tested positive for COVID-19. However, if a student or staff member has been vaccinated, then there is no need to quarantine. If a parent chooses to quarantine their unvaccinated child due to close contact, there are 2 circumstances for the child to return to school. A student may return on day 7 after a negative PCR or rapid test on day 5 or later. Or a quarantined student can return to school on day 10 without testing. Our school nurses can administer a COVID-19 test on campus with parental permission. And we also offer testing for students and employees at the Northeast Sports Park on Wetmore Road. Tests are available there Monday through Friday from 9 a.m. to 4 p.m. Your school nurse may also direct you to this location for testing. Vaccines are playing a vital role in keeping our schools open. They are helping our teachers, staff, and students stay in the classroom and out of quarantine if they do not have any symptoms. I want to be clear, there is not a vaccine mandate. However, we are seeing that vaccines are having an impact on the Delta variant. Local data continues to show that the majority of patients hospitalized with COVID-19 are not vaccinated. If you are eligible to receive your vaccine, I want to encourage you to do so. When vaccines are approved for children under 12, any ISD will work to make those easily accessible to our students with parental permission. There is currently no firm timeline for when the vaccine may be available, but we will share information when it is certain. Our student cases increased last week to 409, up from 291 the week prior. The largest number of cases were in the elementary grades. While that number is higher than we've seen previously, it still represents less than 1% of our student population. Our collective goals are to keep children and staff healthy and to keep our schools open. COVID-19 testing, vaccines, and face masks are mitigation strategies that help protect you, your family, friends, and community. They also help to keep our schools open. I want to thank all of the nurses and clinic assistants who are working so hard to keep our children, staff, and community safe. They continue to rise to the occasion without expecting any thanks in return. We are a healthier and safer community because of our incredible health services team. Thank you for watching, and remember, Monday is a holiday for both students and teachers. Have a safe and relaxing Labor Day weekend.